Should Doctors Tell the Truth? Joseph Collins. Written in 1927, Collins' article presents an interesting take on the paternalistic model of the physician-patient relationship. Specifically, what's interesting about it is the number of ways in which Collins justifies that relationship. Normally, paternalism is associated with doing good for someone else. So as we talked about in the paternalistic model in the previous chapter, we look at a doctor-patient relationship that's paternalistic as if it's between a parent and child. Now, that is normally considered offensive to most if the relationship is between equals, or between two adults, at least. But what Collins argues here is not that the paternalistic model is justified because of the benefit, which is normally how a paternalistic relationship is justified. Parents have a right to do things for or to their children to make them better off. But Collins isn't arguing that that's necessarily what grounds the physician-patient relationship. In fact, what Collins is going to go on to argue, among other things, is that the physician-patient relationship, or this paternalistic model of the physician-patient relationship, is justified on the grounds that, in fact, the patient is consenting to this, that the physician is duty-bound to sometimes deceive a patient. So when a physician is treating a patient, there may be cases in which the deceit is actually required on the part of the physician. Now, the duty to deceive is not unqualified. Collins isn't saying that all individuals or all patients ought to be lied to or deceived. He's saying that there are a certain group or class of patients where this is required. And so he's going to set out the 4 types of patients he's experienced. And even if those 4 types, if each of those 4 types has said, for instance, now you may tell me the truth about my condition, Collins argues that at least one of those 4 types does not actually want to know what their condition is, and in fact would be harmed by the physician giving that sort of information. Four types of persons and the request, now you may tell me the truth. According to Collins, there are 4 types of individuals who will make the statement, now you may tell me the truth. In not every instance are we to actually tell those people the truth, though, says Collins. So are those who honestly want to know so they can prepare. Collins says that these are rare individuals who actually want to know the nature of their condition and prepare for the inevitable consequences or the inevitable outcome of their condition. There are those who do not want to know, and if they were told, would be injured by the information. This second group of people is who Collins is most concerned with. In such cases where the physician knows that a person would be injured by this, even if they may be asking for you to tell them the truth, what they really want is not to be told the truth, says Collins. There are then those who are wholly incapable of receiving the truth, and although Collins isn't specific about this, we might think those who maybe are incapacitated in some way or children of some sort, because obviously here the case is for some reason we can't actually give them the truth. And then finally there are those whose health is neither seriously disordered nor threatened, and so when they say it, although they may think that they have some sort of serious condition, Collins says these individuals will be the ones who you could actually tell without having to worry, because obviously there's nothing to actually tell them. So of these 4 types of persons, what Collins wants to focus on are those who fall into category 2. Justified deception. As was mentioned in the previous slide, according to Collins, we may deceive patients who do not want to know and if told would be injured by the information that we would give them. So we may deceive patients even if they've explicitly stated, now you may tell me the truth. So according to Collins, it's a physician that should be able to tell by knowing their patient whether or not the patient actually wants to know. After all, patients normally don't come in and say, I'm going to tell you to tell me the truth, but don't tell me the truth when I say tell me the truth. So for Collins, it's left as somewhat of an open question as to how I know when I'm supposed to deceive, as patients normally don't tell me that or explicitly state that. But according to Collins, he can tell when a patient, and he thinks most physicians can tell when a patient doesn't want to know the truth about their condition. And as he states on page 139, they sense the gravity, and the last thing in the world they wish to know is the truth about it, and to learn it would be the worst thing that could happen to them. So Collins says that in such cases where the physician has an understanding of the patient such that they can recognize that this would harm them in some way, the doctor has an obligation not to tell the patient the truth about their condition. Moral principles. Collins is actually giving a number of different principles, or offering a number of principles to defend the physician's actions. In some cases, the principles he's appealing to are to defend a particular action, so a physician giving patient or not giving a particular patient information. And his arguments also seem to attempt to justify paternalism generally. With regard to individual actions, he's using both teleological and deontological sort of arguments. So teleological arguments, outcome-based, Collins is essentially holding that beneficence and non-malfeasance, beneficence to do good, non-malfeasance to not cause harm, requires, that the physician sometimes deceive their patient about their actual condition. On the other hand, deontological principles are duty-based. And what's interesting about Collins' approach is that he believes he's doing both. He is both looking out for good outcomes, which he's required to do according to those two principles, but he also has an obligation to respect the person's right to choose not to know the nature of his or her condition. So according to Collins, when dealing with an individual patient, he's doing two things. He's balancing both a teleological and deontological approach. On the one hand, he's saying, I as an individual can't cause any harm. I should benefit and not cause harm. On the other hand, he says, and I'm further justified in this action because I know that this individual doesn't actually want to know the true nature of their condition. Justified paternalism. According to Collins, paternalism in medicine in general is not justified by outcomes. So as mentioned on the previous slide, he gives both teleological, outcome-based, and deontological arguments for particular actions. But his general approach to the treatment of patients and the care of patients is paternalistic, but it's deontologically justified. So paternalistic relationship is based on an implied agreement of the medical professional to pursue the relevant interests of the client. So what Collins was saying back in 1927, and we can ask whether or not this model is still an acceptable model or one that most people agree with, but at least then Collins was saying that when a patient comes to a doctor, there is an implicit understanding, an agreement between them, that the medical professional will do what's in the interests of the client, will try to help the client in any way they can, and not harm. And part of that implied agreement is that in at least certain cases, the physician will keep information away from the patient so that the patient won't be harmed in some way. Now this is a deontological justification. Collins isn't saying because I make the patient better, I'm justified in not giving them the information. What Collins says is that in certain circumstances, given certain types of patients, they have implicitly agreed to not get this information, and thus my actions are justified, says Collins. And in fact, he can then go on to give more justifications based on those various cases that he mentions in the textbook. But for our purposes here, the end result of Collins' article is this. The truth is not something that we need always observe. And in fact, in a large number of cases, which he states himself, most people don't want to know the actual nature of their condition. It's an exceptional individual that's ready to get the information to prepare for the worst. The other individuals normally aren't sick in the first place, so giving them the information isn't a problem. And those who can't receive the information, well, we don't actually have much of a problem there. And since most people fall into the group 2, those who couldn't handle it if gotten, Collins says the best thing we can do as a physician is not provide that information.